Hello, my name is Seth Hemker, and today I'm going to teach you a little bit about asthma. I'm going to do a brief overview on the pathophysiology or the disease process, the prevention, the treatment, monitoring of that treatment, and some lifestyle changes you would need to make. The pathophysiology or the disease process of asthma it's a chronic airway disease that causes the tightening and swelling of the airway. And as you can see on the picture, your airway is the tubes that go from your nose and mouth all the way down to your lungs in order for you to breathe. When these tubes have asthma and they swell and they tighten, like the picture shows there, it decreases the diameter of the tube. When that happens and the wall starts thickening and mucus builds, you can no longer bring air in as efficiently as you normally would. Some causes is the exposure to various irritants and substances that trigger the allergies, also called allergens. And it can vary in their signs and symptoms of them. So several triggers that people normally see is pet dander, infections such as a common cold. People will get exercise-induced asthma. Cold air can trigger it since they naturally have a small set of tightening in your airway. Strong odors, or even GERD, as you might have heard your parents say that they have while they're taking some sort of Nexium or Tums all the time after dinner. On the prevention side of asthma is you cannot cure it, but that doesn't mean you cannot prevent it, or prevent the symptoms making it worse. Some ways that you would want to prevent and to help control the asthma is learn how your asthma works, what triggers it, and how to avoid those triggers if you can, or limit the amount of triggers around you. You really want to follow a written asthma action plan, seeing when you are needing inhalers, seeing what time of the year or time of the day your symptoms seem to be worse than other times. Use your medicine that your doctor prescribes. We'll discuss later some of the long-term medications that you would want to use, and those will be used on a daily basis to really help you keep your symptoms under control. So the other part is just to identify them, and if you do have exercise-induced asthma, that's not an excuse to stay out of gym class. You do need physical activity because it is part of the healthy lifestyle and will help with your oxygenation, getting oxygen into your body. So keep track of all your asthma symptoms and when they're happening and why they're happening. And the big part is just get regular checkups for your asthma with your doctor. Some treatments is prevention and long-term control are the key in stopping asthma attacks before they start. That's taking those long-term inhalers on a daily basis to reduce the inflammation of the airway. Some common ones that you will see is Flonase, Pulmicort, and Advair. The doctor can prescribe you a short-acting or an emergency inhaler, as they might call it. It is usually albuterol, and it is supposed to be used right before maybe you start a physical activity that normally triggers it, or during an asthma attack you can open it. These work within minutes and really start opening up the airway by relaxing the muscles. The long-term ones, they are safe to use. They do take several days to weeks to build up into the system. That's why they are important to continue to take on a daily basis. And to know that they are safe for you to use over long term, they will be okay. Once again, on the treatment part there is just really trying to avoid what really triggers your asthma, and that's by paying attention and writing down what is happening around you when these flare-ups happen. In monitoring the treatment here, you want to follow an action plan and record the results. The bottom here picture of the asthma action plan is one that you could use. So they use a standard stoplight procedure looking to it there, where green means that day has been doing great, you've had nothing going on. Yellow means you might want to get into one of your quick inhaler muscles to relax those airways because they are tightening up. And then red, you need to be seen by a doctor. You're having real difficulty breathing. You want to track on this screen here with it on the action plan how many times you are using a rescue inhaler. Optimally, you don't want to be using it every day, and you definitely don't want to be using it several times a day. The bottom picture here on the right is different inhalers that we have in the US. Just so you know that they do look different. They're not that standard one there that you see in the upper left there with the red and the orange cap. Probably the most popular one you see, but there are different varieties. Picture up there on the top right with the gentleman, he's using your peak flow meter. Using these is a great way to see how much air you're getting in and how much you're going out. So if you're struggling, the doctor will tell you what you need to be. He might tell you on the different numbers vary, you want to get up to 500 on a small one like that. So you just blow out hard in a single blast blow and see what you get the little ball up. It's like a competition. Some lifestyle changes, as said, is to reduce the triggers around. Pollens in the air is a great way. A lot of people that get asthma and get triggered, the asthma attacks. One way you can decrease that is by actually using an air conditioner, since there are filters in place to pull out some of those, where an open window allows that stuff to blow right in. Also, simple dusting. That means listening to your parents and following your chores there, and dusting your living room, your bedroom can keep that down, as well as covering up your mattress. You can get a cover for it and decrease the amount of dust and dust mites there on your sleeping surface at night. And you can get allergy tested to find out what is actually causing it and keeping them under control or limiting to what they are. Doesn't mean if you're allergic to pet dander that you have to shave your dog or get rid of them. Just have to find out how bad it is. So in conclusion, we discussed that asthma is not curable, but it is controllable. You need to prevent and limit triggers in your environment around you. Have and follow an asthma action plan. There are long-term medications out there for daily use to help keep your symptoms under control, as well as the short terms that we talked about that can help you in an emergency. Big part, just make sure you're actually getting to the doctor and following up. Reference, if you have any questions, feel free to contact me.